Cancer is the leading cause of death for Hispanics in the United States, and Latinas at more risk. We discuss this and more with Dr. Val-Marie Ramos with AtlantiCare. It's all here on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Cancer is the leading cause of death for Hispanics in the United States. And joining me to discuss this and more is Dr. Val-Marie Ramos. She is a medical oncologist for AtlantiCare. Dr. Ramos, welcome to Latino Motion. Actually, welcome back to Latino Motion.
Thank you. Thank you for having me back. It is my pleasure to be here. I'm so excited, and I'm also thrilled to be able to work with you and with my Latino community.
So I know the last time you were here was about 5 years ago, and it's important that we continue to bring the message out about healthcare and health issues. But at the beginning, my statement was that cancer is a leading cause of death for Hispanics. Tell me, is that the same case for everybody else?
No. Unfortunately for Latinos, for almost a decade, cancer has been the leading cause of death. For other ethnicities and races, it is heart disease. But usually based on disparities, Latinos just keep getting, essentially dying more often of cancer and being diagnosed with cancer, especially cancers that we should be able to take care of, that should not lead to death. So it is very important to always educate our Latino community so that we're able to continue to bring the message that there are things that we can do in order to change those numbers and, to lead a healthier life.
Now, I know there's also, it seems to be a disparity in terms of cancer for men and women, Latino men and women, yes. A bit of a difference, and certainly higher risk for Latinas. Tell me more about that. So even though Latinos get diagnosed with cancer less, let's say, as compared to white Caucasians, Latinas specifically die more often of certain cancers. This is the case for cervical cancer. And the literature out there, what it essentially states is that the reason that Latinas die more often is because of disparities, usually language barriers. Now they do not have access to health insurance. They do not have available days at work in order to be able to go to the doctor if they have any symptoms. So all of these things are heartbreaking because all of these things, if we take care of them, we should be able, again, to change those numbers so that Latinas don't continue to die of such a preventable cancer. Yeah, you mentioned some of those barriers, right? Certainly, one of them, obviously, is access to health care. And
Yes.
You mentioned some of the barriers, including health insurance.
Mm-hmm.
So tell me, in terms of the disparity, educating our community is very important. That's a critical part as well.
So I believe the most important thing is to understand that for certain cancers, because unfortunately we do not have screening for all of them, but we do have screening for certain cancers. And specifically for cervical cancer, Pap smear is able to prevent the cancer 100%. That is not the case, let's say, for breast cancer, where mammograms are usually able to detect the cancer at an early stage. Cervical cancer is able to see the atypical cells, the bad cells, before they become cancer, and we're able to take care of that before it becomes cancer. So screening is very important, and it definitely can change the outcomes in the long run if these women are able to get health care on time.
So let's break down a little bit about what is cancer and some of the different types of cancers.
So cancer is essentially a very easy way to see this. Just one cell that became bad, and then that cell started making a clone of itself. You know that it is normal for us human beings to be in a room, and you will not think anything weird if you see twins or triplets. But if you walk into a room and you see 10 birds, it might not be. Yeah, so at some point, that bad cell acquires the capacity to reproduce itself faster than normal cells, and that's how it conquers. That is essentially a very easy way of seeing cancer. And then once it starts reproducing itself, it acquires the capacity to go to other organs, and it damages the function of other organs. And that's how cancer spreads, and that's how it kills you.
Now, let's talk about the different types of cancer. Obviously, cervical cancer impacts women, and it's a leading cause of death.
Yes.
How about the other type of cancers, including the cancers that are more common for men?
So for men specifically, the most common type of cancer has been prostate cancer, but that's not the leading cause of death related to cancer. Men die more often of lung cancer, even though they get more diagnosed with prostate cancer. For prostate cancer specifically, there's also screening. For the longest time, it has been a rectal exam along with a blood test. In the Latino community, it has been an issue, having a man going to the doctor to get a rectal exam, because in most of the culture, that's not something that they're used to hearing or talking about.
Right.
For lung cancer, we offer low-dose CT scans, and this is specifically for smokers or people that have a predisposition to lung cancer. Through AtlantiCare, we do have something called the lung cancer clinic. So it is essentially a lung nodule. Usually you can get some spots in your lungs when you were a smoker. And then once we find them, those need to be followed closely. And we have a specific clinic through the pulmonologist that we can follow through and repeat your scans as needed, because those spots may become lung cancer. So again, some cancers we cannot prevent, like lung cancer in this setting, but we're able to detect it on an early stage so that we can take care of it better.
And there's also other types of cancer, like skin cancer, et cetera. Tell me more about those.
So there's so many cancers, Bert. Like we cannot even go through them.
Right.
But in the general population, I'm going to say the most common in women is breast cancer. For men, we have prostate cancer. Also in those top spots are colon cancer, for which we do have screening, colonoscopies. We have lung cancer. We have also other cancers related to smoking, like bladder cancer, kidney cancer, head and neck cancer. We have muscle cancers. Those are called sarcomas. So we see all of them at the cancer center. All of them require different treatments. So it is such an extensive area to discuss, And
Now, some of the cancer is kind of like a silent, right? That you don't see the symptoms necessarily until, it's detected by a physician.
Yes. So some cancers you may be able to at least think outside the box and say, maybe I should screen for this person. Let's say someone comes to the office and they have their yearly exam. And part of a yearly exam is having blood drawn. And then I see abnormal liver functions. So I'm like, okay, is this person an alcohol drinker? Would they have hepatitis, which is a known risk factor, hepatitis B and C, for liver cancer? And then thinking outside the box, that person might send an imaging of the liver. And then, boom, the patient hadn't had any symptom. It was just an abnormal lab.
Now, is there any hereditary? In other words, if you had cancer in your family, is it likely that you may have it as well?
So not necessarily. About 20% of cancers so far, because I think this is going to change in the future, but what we know right now of oncology is that about 20% of cancers are hereditary, are genetic. Very important that if we have any family history of cancer, we should talk about that with our doctor. First-degree relatives, those are children, siblings, and parents.
So one of the things we want to discuss is really some preventive measures, including lifestyle changes.
Yes.
We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion as we continue our discussion with Dr. Valmarie Ramos. She's an oncologist for AtlantiCare. And Dr. Ramos, we were talking about the risks of cancer and the fact that Latinos die more frequently from cancer than any other disease. We want to talk a little bit about prevention, and I think you alluded to that in the prior segment about some of the actions that people could take to detect cancer early on, and that's the best way to survive, right?
Yes.
Tell me more.
So screening saves lives. I could die saying screening saves lives. The day that I die, I will be screening saves lives. So the point here is that do not miss your screenings. For cervical cancer, which we've talked about already, there's the pap smear. For colon cancer, there's the colonoscopy. So going back to cervical cancer, screening starts at 21 years old, irrespective of if that person is sexually active or not. Both the colonoscopy and the pap smear are able to assess cancer before it happens, because in the setting of cervical cancer, again, a precancerous lesion can be taken out before it becomes cancer. The same thing with the colonoscopies. Usually cancers come from a polyp that becomes cancer. So through the colonoscopies, we're able to get those polyps out and no cancer. We have other types of screening, like for breast cancer, with the mammogram. Mammogram starts at age 40, or if you have a family history of cancer, your mother, let's say your grandmother, specifically your mother, because it should be a first-degree relative, you should start 10 years before that person had cancer.
Now, you mentioned age 21 for women to be screened.
Cervical, yes.
And how important is that to begin that regimen early on?
Absolutely important. A lot of women believe that because they're not sexually active, they should not be having pap smears. But even though there is this virus called human papilloma virus, HPV, is the leading cause of cervical cancer, because that virus causes chronic inflammation in the cervix, which becomes cancer in the future. You can develop cervical cancer from chronic inflammation of other causes. It doesn't need to be related to a sexually transmitted disease. So at age 21, all women should start the screening for cervical cancer.
And you mentioned being screened for colon cancer as well. What age should that start?
So you know that up to about 5 years ago, and that's what most people remember, screening for colon cancer was at age 50, or again, 10 years before a family member had colon cancer. But that number changed to 45 years old, because now we are finding that a lot of more people at the age of 50, late 40s, early 50s, have colon cancer. So that means that we need to decrease the age of screening so that we're able to catch this while it is a polyp or a precancerous lesion.
And some of the data that I saw that it's like a 40%, most cancers are at least 40% preventable.
Not necessarily most of them, but the ones that we have screenings, yes, because screening does work. The earlier we are able to find a cancer, the better the prognosis and the less aggressive the treatment. So as cancer progresses and it starts getting, let's say, bigger or going to other structures, the treatment is usually more aggressive, and by then the person is already sick, so offering treatment might be difficult. Not impossible, but difficult.
So let's talk about those barriers that we mentioned earlier and just to try to break them down, right? That we mentioned the fact that language was a barrier.
Yes.
So tell me how health institutions like AtlantiCare are breaking down those barriers.
We have an awesome group of doctors.
Including yourself.
Thank you. I will say that all of us, we speak more than one language. And then in my specific setting, I speak Spanish. So I am a huge advocate for my Latinos because you cannot express it. Even if you're bilingual, there's never a better thing than to be able to talk to your doctor in your language, because a lot of things are missed because of the language barrier. If one of the doctors do not speak a specific language, we have what's called a translation line, and we're able to get any language at any time of the day, and even dialects, because we have been confronted with patients that do not even speak a specific language, they speak dialects. So we will always be able to communicate with our patients.
Another barrier is lack of insurance, and we know that AtlantiCare has the FQAC,
Yes.
where you could go and get an appointment without necessarily having insurance and getting some free care.
So not having an insurance will never be an issue for seeing a medical oncologist or any other doctor through AtlantiCare. So if that's the specific setting of our community, they should talk to their primary care or call directly the cancer center so that we can go over the available help, any documents that may be needed, but even treatments for cancer will be completely taken care of, even if you don't have insurance.
Let's talk about lifestyle. What lifestyle changes are recommended in the prevention of cancer?
So smoking cessation. If you are a smoker, it is never too late to quit. Because some people are like, I already have cancer. I've heard that so many times.
Really?
It doesn't matter. It is never too late to quit. You can develop another cancer, just so you know, because of the smoking. Also, smoking is one of the risk factors that increases over 40-fold your risk of cancer as opposed to someone that doesn't smoke. Appropriate weight. So whenever a doctor talks to you about your weight, it is very important that the person realizes that we're not trying to make you feel bad. Is that increasing BMI, body mass index, increases the risk of certain cancers, including endometrial cancer, that's uterine cancer, ovarian cancer, breast cancer, pancreatic cancer, which is so aggressive, life-threatening. So having an adequate weight is very important. Control the alcohol intake, drink water, exercise. There is a study, a very well done study for breast cancer, where it was shown that just walking for 30 minutes a day decreased the risk of breast cancer in women. So these are things that they sound like, oh, that's easy, but a lot of people do not do it. If you're gonna go outside, sunscreen. Skin cancer is not even part of the statistics because it is not mandatory to tell the federal government about the cases, because a lot of them you just get surgeries or you just burn them, but skin cancer is everywhere. So something as easy as using your sunscreen can save you from having skin cancer in the future.
Are there any dietary recommendations that could help?
Yes. So even though the data on, let's say, red meat for colon cancer is not as strong, because I talked to you about smoking and over 40-fold risk. For eating red meat and things like Spam, sausages, those kind of meats, it does increase your risk of having colon cancer about 4-fold. So you see, when you compare that to smoking, it sounds like it's not a big deal, but it is. Also, when you shouldn't be eating red meat for the heart. That's not great for the heart. So control your red meats, maybe once a week, twice a month. That's a good number. And also beware of the things that you're putting into your body.
So there's a lot of things to be aware of, certainly. We want to talk, change gears a little bit as we take this quick break and talk more about treatment options. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion with Dr. Valmarie Ramos. She is a medical oncologist with AtlantiCare. And Dr. Ramos, again, we were talking about prevention and some of the lifestyle changes that would be helpful as well. But let's talk about the treatment, right? There's certain treatment options. Tell me about what kind of treatment options are available.
So depending on which type of cancer the person is diagnosed with, it could be just one treatment or a combination of treatment. Through the Cancer Care Institute, we're able to offer state-of-the-art and up-to-date chemotherapy or immunotherapies. These are usually infusions given through the vein. We're also able to offer injections, which may be also chemos or immunotherapies, because everyone thinks that's just a vein thing, but it could even be pills. We offer radiation therapy. A lot of people may confuse medical oncology versus radiation oncology. So as a medical oncologist, we're the ones that give the infusions, the pills, the injections. And then radiation oncology is a huge machine which essentially moves around you and then it burns the cancer while it is still inside of you. For certain cancers, we offer surgery. So let's take, for example, breast cancer, which is the most common cancer in women. Breast cancer may need a combination of surgery, sometimes up front, but sometimes in the middle, just so you know, because the order depends on what type of cancer and how far along the cancer is. And then those patients may get radiation after the surgery, and then they get a pill after. But some patients may need surgery, followed by chemotherapy in the middle, followed by radiation. So surgery, radiation oncology, and medical oncology we offer through the Cancer Care Institute.
Dr. Ramos, you mentioned the AtlantiCare Cancer Care Institute. Very important, and certainly it is a nationally recognized program that's available right here in Southern New Jersey. Tell me more.
So the AtlantiCare Cancer Care Institute is accredited by the American College of Surgeons on Cancer and also the American College of Radiology. That's specifically for radiation oncology. So here, locally, we are able to offer the latest, the most up-to-date, and also safest treatments. The same treatments that you will be offered elsewhere, because cancer it's treated by guidelines, and those guidelines are the same for any medical oncologist in the United States.
And of course, equally important, particularly for nuestros Latinos, is the fact that we do have bilingual, bicultural staff like yourself that work at the Institute. Let's talk about the multidisciplinary approach that you take at the Institute.
So cancer should be taken care of as a team. So it shouldn't just be the medical oncologist or the surgeon calling the shots. So whenever we're gonna offer a treatment to a person, we go over all of the subspecialties that are involved in the treatment, which is not just radiation, surgery, or medical oncology. We also have pathology, the radiologist, social work, physical therapy, all of the things that will be in need at some point through the therapy that we offer. And then we make a plan based on guidelines for that specific person. Because even though every cancer has a guideline, we're all different human beings. So we're offering treatment that it's according to guidelines, but specifically for that person based on a multidisciplinary team that comes together to offer the best treatment for that person.
And I had the opportunity to witness some of the cutting edge technology that you have at the Institute. There's that Da Vinci robotic that you're able to put a rubber band on a dime. So you're able to use that cutting edge technology to treat specific cancers. Tell me more about that.
So through the robotic system, we're able to decrease the time that patient needs to heal. These are very little incisions, and usually patients bounce back right away. And then this specific technology is used for certain type of cancers like prostate cancer, uterine cancer, ovarian cancer. So we're really up to date with technology.
And certainly the arts play a big part in the building itself. Tell me more about that.
I don't know if you know, but I used to be a professional ballerina
Oh,
up
really?
to my 30s. So you see, art is so important for me. And a
Nice.
cancer center is a work of art. There's art everywhere. There are paintings, there's sculptures, there's music. So I am a true believer that art heals from within. And while you're receiving your treatment, you're going to be in a beautiful state-of-the-art cancer center, just engaging in all of these pieces, in all of this art. So I truly believe that that also helps with the healing process.
Just going back a little bit to the cutting edge technologies, I know that what separates some of the major institutions is having those clinical trials.
Yes.
And we have that at AtlantiCare. Tell me more about that.
Yes, we have a specific program. It's not new, but it seems like we get better every year. So we are up to date with the most important clinical trials around on prostate cancer, lung cancer, breast cancer, and we are able to bring them to our community through our cancer center. So these studies may not be only, happening in the United States, but these are also clinical trials that may be worldwide that we're bringing to our patients because we need to be up to date with treatments as well.
Well, Dr. Ramos, I want to talk a little bit about you specifically, and as a Latina, tell us a little bit about your background. I know Puerto Riqueña. Tell me more.
So I was born and raised in Puerto Rico, Cabo Rojo. So I grew up in the beach using sunscreen. No, I didn't, but now I do. I moved to the mainland, to the United States about 10 years ago. I did my medical training in Puerto Rico. I was able to take care of my Latinos for a very long time. And then I moved here. And even though I miss my Puerto Rico every day, my heart is full because I do get a lot of Latinos here. I'm able to speak Spanish. I'm able to work with my community. So it is a blessing every day.
I understand you spent some time in Mexico as well.
Yeah, so I lived in Mexico a few years. And this is, back in my 20s. And I love tacos, I love Chile, but it's at some point the beautiful story had to end. And Mexicans are very different from Puerto Ricans, but it just showed me how much I love my Hispanic community because the love that I have for Mexico, it's just as much as the love that I have for Boricuas. So you see, it's just that we're just one person, we're one people, we're one community.
So early on, we started talking about this big disparity for Latinas. Mm-hmm. Tell me what message you would give to Latinas about their health and cancer.
So the most important thing is do not delay your checkups if your body is telling you that there's something wrong. Yes, it is very important to have your yearly checkups. That is extremely important. Even if you feel you're healthy or young, you should still get checked at least once a year. But if your body is trying to tell you something, do not ignore it. Do not justify it for something else. Let's say I'm having heartburn every day, and I believe it's something that I eat. I may have heartburn. At some point, you get diagnosed with gastric cancer, but you've been having heartburn for years. You just keep saying it's something I ate. So please just go to the doctor, get your checkups, and do not ignore anything your body is telling you.
Dr. Ramos will end the show right there. Thank you so much for coming on the show, and I'm sure we're not going to wait another 5 years to have you back. And thank you for joining us once again here on Latino Motion.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.